Welcome to our presentation of We're All in This Together Siblings of Individuals with ASD, presented by Nathan and Karuna. We will become caregivers for our siblings when our parents no longer can. Anyone interested in the welfare of people with disabilities ought to be interested in us. Introduction. The unique connection of a child with ASD and their allistic siblings of children with ASD are as unique as their family situations, but share similar positive and negative experiences, despite what birth order they are or the severity of their autistic siblings' challenges. The family structure regarding treatment of every member of the family in families with a child with ASD is highly weighted in how siblings understand themselves and their place in various group dynamics. Growing up with a sibling with ASD brings forth a constant stream of personal growth challenges that can either lead to a sibling to address these challenges as either burdens or opportunities. The relentless pattern loops and evolves as both siblings mature from childhood to adulthood. As many focus on the challenges of the autistic child, it is equally as important to acknowledge the feelings of their most loyal role model, their sibling. Family dynamics. The special bond between an autistic child and their allistic, non autistic sibling is an impenetrable one, forged with pride, duty, adaptation, compassion, commitment, and reserve building. The bond between allistic and autistic siblings is shaped by a number of factors from their individual personalities to the family environment and the nature of their experiences together. And while these siblings' relationships are largely rooted in deep empathy, understanding, and support, they can also result in feelings of jealousy, guilt, or even resentment, usually due to the amount of attention an autistic child receives both at home and in social situations. Whether the sibling is the older, younger, or both, they form an unbreakable bond that continually aids to their personal growth with each moment. That bond was created in the home. It is developed and nurtured by each family member. For example, older siblings might feel the sense of responsibility toward their autistic sibling and feel tentative about building a life outside the family unit. Younger siblings gain independence and develop skills and relationships that lead them to surpass their older, developmentally delayed autistic sibling. As all families do, siblings with a child with ASD assume their roles in the age hierarchy of the family. However, whether you are the older sibling or not, you become a modeler in addition to your traditional family role responsibilities. Younger siblings lack the proper sibling modeler, thus increasing the chances and severity of behavioral and emotional difficulties. Younger siblings gain independence and develop skills and relationships that lead them to surpass their older, developmentally delayed autistic sibling, which may lead to jealousy in a young or mature autistic adult and or feelings of embarrassment and abandonment when their siblings achieve lifetime milestones such as living independence, career advancement, marriage, and parenthood. In a turn, the allistic sibling harbors feelings of guilt when gaining their independence. Often, siblings feel guilty communicating their frustrations with their autistic siblings, especially to their parents, because they know you, parents, are also overwhelmed. Siblings of autistic children are more likely than siblings of a children without the condition to be withdrawn and to have poor social skills. They also fare worse socially and emotionally by various measures than do siblings of children with intellectual disability or other forms of developmental delay. The temperament of the parents is an initial indication of how an allistic sibling may behave. The parent's stress reaction and disposition are influential in the sibling experience. How each parent involves themselves with the autistic sibling from a loving or begrudging attitude is immediately influencing how their sibling should treat their sibling and anyone else in a similar fashion. Positive outcomes that siblings frequently mention are learning patience, tolerance, and compassion, and opportunities to handle difficult situations. These opportunities also taught them confidence for handling other difficult challenges. A mother's mental and physical health is probably the most important factor in predicting sibling adjustment, regardless of the presence of any disability in the family. Increased parental stress can lead to negative developmental patterns in the neurotypical child. Treating each child exactly the same, no matter the cognitive differences, may initiate feelings of resentment towards the parent and even their autistic sibling. This unbalanced parental practice undermines their coping skills and ability to shift towards each individual child's need to provide the proper behavioral support. Over time, the behavioral challenges have the potential to develop coercive cycles of parent child interactions, in which parent and child behaviors have been shaped into stable patterns of negativity. Longitudinal studies have demonstrated that parents of autistic children report increases in the negative, controlling behavior on days when they feel more parenting stress or after their children display high levels of externalizing behaviors. Overall, caring for a child with ASD can lead to a reconfiguration of family dynamics and an impact on interpersonal relationships, highlighting the importance of providing support at both the family and social levels to mitigate these efforts and strengthen family cohesion. Impact of being a sibling of a child with ASD. Most of the illistic sibling experience is a mixture of caretaker, friend, rival, and advocate, depending on the era in life the siblings are currently in. The challenges and benefits also seem to vary depending on the status of the siblings within the family age hierarchy, as well as severity of the support needed for the sibling with ASD. Developing siblings of individuals with autism spectrum disorder. Concerning siblings whose elder sibling has ASD revolves around cause for concern regarding the carryover with genetics repeating in all the younger siblings. The findings jibe with the broad autism phenotype theory, which posits that family members of autistic children share some traits of the condition. Younger siblings seem to exhibit behavioral issues such as more difficulty in establishing emotional closeness, social communication, and interaction with other people. These negative emotions experienced by siblings can negatively affect their social relationships and adult lives. Children may observe the lack of communication and emotional regulation from their sibling with ASD and deem it acceptable, and thus model it, having than employing the more appropriate rather than employing the more appropriate behaviors. Notably, if the eldest is a boy with ASD, the younger siblings' chances of behavioral incidences increases. These siblings shared the difficulty they experienced in juggling the changing and developing nature of their relationship with their autistic brother, describing relationships initially mixed with difficulty, sadness, and frustration at communication difficulties, and the minimal exchange, then exchanging to encompassing love and protectiveness. When the sibling with ASD is the youngest, the elder sibling, while taking on a more protective and nurturing role earlier than most eldest children, they understand why they aren't getting the attention. Some may crave it more, rebel, and some may repress it, adjust, and assume this is the way of life and continue that secondary role as they mature. Older siblings experience more caregiving responsibilities and frustrations related to having a sibling with ASD. Having a sibling who has an autism spectrum disorder can impact typically developing siblings' self identity and personal development in a number of ways. While the sibling relationship might provide many positives for the child with ASD, detrimental impacts are noted in siblings. 15% of siblings aged 10 to 18 years of children with varying disabilities were at risk or in the clinically significant range for emotional symptoms and pro social behavior. 20% to 30% also met at risk or clinical threshold on overall difficulties and hyperactivity conduct and peer problem subscales. Similarly, when compared to siblings in general, a number of studies have found that siblings of a brother or sister with ASD are at an increased risk of mental health difficulties such as symptoms of depression or anxiety. Siblings of autistic children are more likely than siblings of children without the condition to be withdrawn and to have poor social skills. They also fare worse socially and emotionally by various measures than do siblings of children with intellectual disability or other forms of developmental delay. The findings suggest that siblings of autistic children are at risk of secondary conditions or traits associated with autism, but not core features of autism. Interactions with the sibling who has autism spectrum disorders and with other individuals can evoke a myriad of experiences that can both benefit and challenge typically developing siblings. The strengths of allistic and autistic sibling relationships: empathy and compassion, loyalty and unbreakable bonds, advocacy skills, teamwork and problem solving, celebration of uniqueness. Empathy is the cornerstone of positive sibling relationships. Encouraging siblings to recognize and appreciate their autistic siblings' perspective cultivates empathy. Education also plays a crucial role. Parents need to constantly teach what they learn to their children without ASD. Other than them, siblings will spend the most time and may also be alone with them or without a parent. They need to learn how to communicate to their siblings and how to teach them communication in addition to learning their behavioral tendencies. Growing up with a sibling with autism can have a positive impact. The majority of siblings of an autistic person may develop a more positive self concept and view of their intelligence. They begin to lead towards more empathetic behaviors, developing tolerance, loyalty, maturity, as well as an increased social competence and better problem solving skills. They may talk about taking pride in teaching their siblings and celebrating their siblings' successes. They're leaning they're learning important lessons about respecting individual differences, fairness, and unconditional love. In families where differences are embraced, siblings have the opportunity to celebrate and honor each other's individuality. This, this strengthens the entire family dynamic and creates a foundation of acceptance and inclusivity. Despite the challenges, growing up with a sibling with autism can foster unique qualities in neurotypical siblings. Many individuals credit their sibling relationship for instilling patience, empathy, resilience, and an understanding of diversity.
Relationship between the sibling and sibling with ASD from the childhood to adulthood. During the childhood or early adolescence, siblings especially don't understand the reason behind their sibling with ASD's different behavior. They think siblings with ASDs are also one of their normal sibling for them. They are trying to be playmate or trying to connect with them. They are trying hard to connect with their sibling with ASD. If the attempts fail, they may get frustrated or angry at their brother or sister with ASD, and at the one point, they shut them off from their sibling. They also feel that they are left over from their family and that their parents don't care about them because parents mostly give all their attention to the kids with ASD. Moreover, they feel loneliness, parents are being unfair to them, and they think they are not important for their parents. Overall, when they are in their childhood or early adolescence, they trying to connect with them as a playmate, see them as a competitor, be angry about their sibling because they feel parents are being unfair to them. When they mature or have better understanding of ASD, they become their peers, protectors, or translators for their sibling in social situation, supporter, assist them when needed. With the family support, they discover ways to bond with their sibling with ASD effectively, like playing his favorite video games and board games. Through this process, they develop patience and empathy with their sibling with ASD. As siblings of individuals with ASD are in early adolescence or young adulthood, they often experience changes in their relationship. They take on more responsibility, caring, and supporting for their brother or sister with ASD. They become more protective and advocate for their siblings' needs. As their parents become too old and can care less for their sibling with ASD, they're trying to help their parents by acting as a parent caregiving. Even after moving out from the family or finding a new career or starting college or universities, they work to maintain a strong connection with their sibling with ASD. The dual commitment leads them to struggle or hard to balance with their new life. They may feel confused because their choices will be limited. In early adolescence or young adulthood, siblings of individual with ASD become more careful and responsible for their sister or brother with ASD, but it becomes more difficult to spend the time with them in person because of their new roles. As they grow up, these siblings may find themselves shouldering even more responsibility for their autistic siblings, especially when it's become challenging for their parents or guardians to manage everything. It's a journey that requires understanding, compassion, and willingness to lend a helping hand with the family unit. During the adulthood, relationship between individual and their sibling often become closer. As they understanding their sibling behavior and needs, they become more accepting, tolerant, and empathetic. They become more open or have a conversation about their sibling issues and are willing to share experience with others and advocate for them for both themselves and others. Concerned about the future, they began searching for resources to support a better future for their sibling with ASD and seeking out appropriate future support. Sometimes they also become a primary caregiver for their sibling with ASD. The goal for the caregiver is encourage the autistic adult to accept and adapt to the changes in routine and family structures to ensure that siblings feel empowered to build independent lives while maintaining family connections. From childhood to adulthood, the relationship between sibling and a sibling with the ASD changes in many ways. Early on, interaction may be emotion, playful, or characterized by feeling of unfairness, withdrawal, or a sense of being a helper. Over time, these roles often shifted to being a protector, supporter, and translator, and eventually to acceptance, empathy, advocacy, and sometimes become a primary caretaker as an adult. Strategies to managing the sibling support. Siblings of autistic children often have mixed emotions. Even though they share happiness and have an extraordinary bond with their sibling with ASD, they can also feel anxious, frustrated, and confused. When siblings have a better understanding about their brother or sister's diagnosis, behavior, needs, and challenges, they can understand their part of their sibling's life. It's allow them to effectively handle their sibling behavior issues and other challenges. Keeping sibling informed about specific and general caregiver responsibilities Give them a chance to consider what role they may feel comfortable playing during their autistic sibling later years. Ensuring fairness among the young children is crucial. Creating fair and consistent role for all the children whenever possible and implement positive behavior strategies that encourage all of your children. They need to understand that their happiness and personal growth are equally important and don't conflict with their love and support for their sibling with autism. We can foster positive interaction between siblings. It's bring them to the closer and lead to the better understanding of each other. It will help them to throughout their life. Next, we can explain or provide strategies to help them to manage their own challenges feeling. By promoting mental well-being and self-care, they can reduce frustration and overwhelm. Engaging in activities that make them calm, relax, and feel good, such as painting, prefer sports, spending time with their friends, and hobbies. Moreover, we provide resources to help them to professional support. Resources are available to offer guidance, strategies, and emotional support. In autistic sibling support group, they can find the guidance and strategies that they can in um, respect the care service professional come to the home and do personal care for kids with ASD short-term stay or assist living facilities. So primary caregivers can relax and recharge their energies. These are the 12 important needs of sibling. So they need communication that is open, developmentally appropriate, and ongoing informations. Parental attention is consistent. Need time with a parent. It is very especially for them. Need to learn skill or interaction with their brother or sister. Need to be able to have some choices and how involved they are with their brother or sister. Need to feel their belonging are safe for their brother or sister. Need to be feel that their brother or sister is being treated as normal as possible. Need time to work through their feelings with the patient, understanding and guidance from their parents or professional, and need opportunity to experience as a normal family life and activities. And they need opportunity to feel that they are not alone, that others understanding and share some of same experience, and needs to learn strategies for dealing with questions and comment from peers and others in the community. By fostering a support environment, promoting self-care, seeking external support, and recognize the positive impact of their unique experience, family can nurture resilient and harmonious sibling relationship that endure throughout the trails and terms of life.
Conclusion: navigating their existence within the family and also between their autistic sibling, the neurotypical sibling faces a myriad of personal growth opportunities that start off as challenges and eventually transform into a lifetime of benefits. Although there are countless sacrifices made on behalf of the autistic sibling, it doesn't feel odd. In fact, the strength of the sibling grows with each interaction and every moment, negative or positive, with their challenged sibling. Their bond is not only beneficial to the sibling with ASD, it plays a major role in how their sibling communicates and navigates life's path with other people on the planet. People fear what they do not understand. Understanding is the key to acceptance. To understand that everyone is different and some people need extra help, extra time, extra attention, and a little extra love. Understand that a disability does not give you the right to ever feel you are worthier than someone else. Autism exposes some tough, scary feelings. It forces you to reevaluate and abandon the life you may have envisioned and to begin a new, untraveled, unplanned path. You don't know where this path ends, but you just grab your family's hands and head on down. My parents are the most amazing people I have ever met, and with their love and deduction, Pat and I have grown into young adults with the utmost respect and gratitude for one another.